ESR, or Erythrocyte Sedimentation Rate. This is a really cool lab, okay? For adults less than 50 years old, our normal value is going to be 0 to 15. As an adult ages 50 years and older, we're looking at 0 to 20. So simply by knowing the name of this lab, ESR, or Erythrocyte Sedimentation Rate, right? We know erythrocytes are red blood cells, and sedimentation, we can think about that kind of coming together, falling to the bottom, etc. So really what erythrocyte sedimentation rate is, it's a measure of the rate of sedimentation of red blood cells, okay? And what this is really based upon is it's based upon the fact that proteins in the blood become changed, okay, by inflammatory process and a necrotic process. And what this causes, it causes all these red blood cells, these erythrocytes, to stick together. And as they stick together, they become really heavy and they start to fall to the bottom of a tube. Okay, and so that's really how we measure this, is as these blood cells, or due to inflammation, these blood cells become heavier, these proteins become inflamed, and they stick together, they fall to the bottom. And so that's how that's why we use ESR to measure inflammatory process in the body. Okay, so that's what we're really looking at, is inflammatory process in the body. The problem is ESR isn't specific to a condition, okay? So we don't get our ESR and say, okay, boom, we know what's going on here, okay? But what it does is it's one of the earliest indicators of widespread inflammation, okay? So we can run it and we can find out really quickly there's something going on here that we need to investigate further and we need to really look at. So it's going to be increased, obviously, in inflammatory diseases, myocardial infarction, anemia, Crohn's disease, endocarditis, nephritis. So if you're thinking these inflammatory processes, right? Rheumatic fever, rheumatoid arthritis. So we're going to see it increased in these inflammatory type conditions. So while this is not a specific lab, it's a very important lab to quickly and early identify inflammatory conditions, inflammatory diseases, and be able to give the provider and the nursing staff and everything what they need to go and start targeting what's going on and try to figure out more what's going on with this patient. So again, our normal value for patients less than 50 years old will be 0 to 15, and for patients older than 50, it's going to be 0 to 20.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.